All right, so a little bit of, technical kind of stuff I would throw in there to chew up a little bit of time, but just to understand, issues that can happen with semen quality and, some of the things that I look for when I evaluate semen. So we've got issues where there's no sperm. The dog's a dud. Why is there no sperm? Those are usually very difficult cases, and there's little we can probably do to get a dog back from being fertile if they absolutely have no sperm. Now, oligospermia, so you have a low number of sperm. So, but just keep in mind, small dogs will have smaller volumes of not volumes, but, well, they'll have smaller testicles, so they'll have less number of sperm. And now there's got to be something about smaller dogs requiring less semen and still being able to get pregnant, because generally small dogs have a small number of sperm to give up to the bitch. But I guess everything is smaller in a toy bitch, so the sperm probably doesn't have to travel as far, and you don't need as many to get a smaller dog pregnant. But the general rule is you want about 150 to 200 million sperm, or progressively motile sperm, to have a reasonable success of getting the bitch pregnant. So blood and semen. So this is probably something, if you're doing collections at home, you may notice that sometimes there is blood in the semen. And then it's like, well, where is this blood coming from? Sometimes it could be coming from the outside shaft of the penis. Okay, sometimes the dog gets a little too aggressive, a little too excited, and kind of wears the thin lining of the penis shaft, and so you get a little bit of bleeding that ends up mixing in with your collection. And that's why it's nice to have different fractions, so you can kind of separate that out, because you want to try to minimize any type of blood contamination. Another source of blood in the semen is, of course, the prostate. And so if you see, and generally you can kind of tell the difference between blood coming from the shaft of the penis and blood coming from the prostate, because that third frac, usually if it's coming from the penis, all three fractions are probably going to be contaminated, and the outside sleeve is going to be contaminated with blood. Whereas if the blood's coming from the prostate, you can actually see the little squirts of prostatic fluid actually have that red tinge to it. So doesn't mean it's the end of the world that your dog is dying that's got blood in its semen. But sometimes it can be startling. Sometimes it could be the dog just has an overactive prostate, and sometimes it can be normal for some dogs to have a little bit of blood in that prostatic fraction. And if it's just a little bit, it's fine. It can be used. It's not going to really be an issue. If you do have quite a bit of blood going on in there, then the prostate should probably be evaluated, especially if it's an older dog, because generally you can either be dealing with just an enlarged prostate that's inflamed, or you can be dealing with something a little bit more serious, like a prostatitis, which will require antibiotics or further medications to help resolve and treat. So don't always discard the fact that there's a little bit of blood that could be serious, or it could be nothing. I guess the rule of thumb is, if you are noticing blood and you're pretty sure it's coming from that prostatic fluid, then you should probably have your stud dog checked out and just make sure it's not anything serious that would warrant antibiotics. Not to say that you can't use the semen. I would still probably use the semen, unless it's, sometimes that prostatic fluid could be just red. And at that point, maybe you might want to consider having the stud dog evaluated right away just to see what's going on. Now, so a little bit of blood is not going to affect your breeding. When it comes to frozen semen, when I freeze semen, blood does act as a spermicidal agent when it comes to freezing semen. So I have to make sure that when I do my collections for freezing semen, that I try to avoid as much as possible any type of blood contamination, because that's when it will really affect the outcome with frozen semen. All right, other sperm defects you can have is cytoplasmic droplets, bent nets, coiled tails. There's a whole array of defects sperm can have. And the main thing is I don't get too excited about the sperm defects unless they occur in large number. So I'm looking for at least minimum 70 to 75% normal sperm. The rest can be defective, I don't care, but at least I have that minimum number of normal sperm, I'm happy. It's when we're starting to see 50% sperm defects, now we've got something happening. We've got issues. Could be a prostatitis causing it, could be an infection as well that could be causing abnormalities in sperm. So usually when I see a high level of sperm defects, that cues me to investigate a little further. All right. Fancy name, adensozoospermia for decreased progressive motility. I'm going to give it a prize. You can say that 10 times really fast. There's no more prizes. I got this beautiful stuffed dog here that's looking for a good home. It needs a lot of care. It needs a lot of care. Probably a dewormer too. It's got a rough coat. Yes. Okay. And dead sperm. So that's, more for you, but at least you know the lingo and you can kind of look smart in front of your veterinarian. Okay, so this is a little bit something to take away about what we can do to the stud dog, because we can do things to the stud dog that can probably help his fertility out a little bit, and remember, if you have a stud dog that's gone through some type of surgery, sickness, illness, injury, keep in mind that his sperm quality might be affected because of that. In order to improve sperm quality for those dogs that might have reduced sperm quality, we can do a couple things, like glycosaminoglycans, green lip mussel. We can get that anywhere. It's usually in joint supplements where you find green lip mussels. Antioxidants, usually you see those in skin supplements, the vitamin C, E, beta carotene, selenium. So generally when I have a dog that has poor sperm quality, I generally go with a high quality skin supplement that will usually have the omega fatty acids, will have the antioxidants, and a joint supplement that contains green lip mussel. And generally, if I'm having a dog that has a hard time freezing, it doesn't freeze very well, sometimes I'll put them also on this type of protocol to get that sperm quality up and better. All right, so benign prostatic hyperplasia, BPH. So this is something very common in stud dogs, older stud dogs. And this is something that usually if you see blood in the semen in these older stud dogs, this is what we're dealing with. And sometimes it can get pretty serious and pretty severe. And if that's the case, there is certainly medications that can help settle that prostate down. And otherwise, if the stud dog is pretty much retired from breeding, then neutering will definitely fix this. Okay, chronic prostatitis, generally brought on by benign prostatic hyperplasia, but it's just a progression of now the prostate's infected. So sometimes with chronic prostatitis, you really need to hit these dogs hard with antibiotics as well. Acute prostatitis, again, not common. I'm not going to cover it very much. Okay, we got cryptorchidism. And so, again, something that, you guys deal with probably from time to time. And I end up dealing with it too, as far as, my dog doesn't have testicles. Are they going to drop? It's just one of those things that if they're not in the scrotum, but just sitting up a little bit high in the inguinal area, then there is always a chance for those to drop. But usually by the time the puppy's 4 months of age, it's usually not going to drop. Not unless if maybe they're just there and they need a little bit of help to get down to the rest of the way, then we may have still a little bit of hope there. But if the testicles are high up or can't be felt, then definitely don't expect anything after 4 months of age. You know what? There has been some medical treatment in terms of getting these testicles to descend. Okay, sure, you bet. All right, and you know what? It's usually a hit and miss with the treatments. Okay, so I've tried them in the past. Sometimes it works, sometimes it doesn't, and generally not something that I'm really an advocate for in terms of using GnRH to help these testicles descend.